Hey Freedom Lovers, this is Dr. Peterson Pierre with America's Frontline Doctors bringing you today's Daily Dose. Researchers at McLean Hospital, the largest psychiatric affiliate of Harvard Medical School, found that people taking high doses of the stimulant amphetamine, which is, if you didn't know, the active ingredient in ADHD drugs such as Adderall, face a 5.3-fold higher chance of experiencing a psychotic or manic episode. Quote, stimulant medications don't have an upper dose limit on their labels, end quote, said Dr. Lauren Moran, a psychoepidemiology researcher at McLean Hospital and lead author of the study. Quote, our results show that it is clear that dose is a factor in psychosis risk and should be a chief consideration when prescribing stimulants, end quote. For this study, a high dose was defined as 30 milligrams of dextroamphetamine, equivalent to 40 milligrams of Adderall. The generally recommended dose for adults is 20 milligrams of Adderall. People taking doses above 30 milligrams of dextroamphetamine equivalents face a much higher risk of mental health issues. Older adults are even more susceptible to these risks. The team analyzed electronic health records from the Mass General Brigham healthcare system, covering patient encounters between 2005 and 2019. Published in the American Journal of Psychiatry, the study compared patients aged 16 to 35 who were hospitalized for their first episode of psychosis or mania with those hospitalized for depression or anxiety. Psychosis affects how the brain processes information, leading to a loss of touch with reality through hallucinations and delusions. Mania, on the other hand, is characterized by elevated mood, high energy, and euphoria. The research found a 63% attributable risk for any amphetamine use. This means that if people hadn't taken amphetamines, 63% of those cases might have been avoided. Additionally, 81% of cases involving high doses could have been avoided by not using such high amounts. The researchers found that individuals who took high-dose amphetamines in the past month had a 5.3-fold increased risk of being hospitalized for their first psychotic or manic episode compared to those hospitalized for other psychiatric conditions. When compared to outpatient controls, high-dose amphetamine users showed a 13.4-fold higher risk of developing psychosis or mania. There's limited evidence for prescription amphetamines being more effective in higher doses, Dr. Moran said. A clinical study by the FDA found that doses exceeding 20 milligrams per day didn't provide additional benefits. Recent studies show a difference in the risk profiles of two commonly prescribed ADHD medications. Amphetamines, such as Adderall, have been linked to an increased risk of psychosis and mania, while methylphenidates, like Ritalin, do not appear to carry this risk. Ladies and gentlemen, only the truth will set you free. Stay tuned for the next Daily Dose.